My name is Sultan Zaidan. I'm an interventional physiatrist. For those who don't know what that is, it's a physical medicine and rehabilitation specialist, and I work here at the Michigan Head and Spine Institute. I was born here in the Detroit area and did my medical education at the Wayne State University. Subsequent to that, I did my residency in physical medicine and rehabilitation at William Beaumont Hospital. After residency, I did have the opportunity to train at the Cleveland Clinic in medical and interventional spine care. It's a fairly unique opportunity in that at that institution, the non-surgical and surgical departments work fairly closely together under one roof and work hand in hand to provide complete care to and comprehensive spine care to the patients. There's a fair amount of difference between a neurosurgeon and a physiatrist. First and foremost is physiatrists do not perform actual surgical procedures. So I would take care of pretty much everything up to the point where they need surgery. So when a patient comes in with a problem in their spine, I can come up with diagnose them first and foremost as far as what their primary problem is. I mean, people can have problems in various areas of their bodies that's causing some functional limitation or pain complaint, and that can be from either degenerative changes, so things like degenerative disc disease, spinal stenosis, sports injuries. A lot of people are weekend warriors and try and stay active and maybe overdo it sometimes and end up with a condition that would require them to come in and get evaluated. If it's something that they've been dealing with for a little while, or if it's an acute problem, a lot of times their first stop is their primary care physician. And a lot of times patients, will improve somewhat with routine care and conservative measures there. If things are persisting or not improving to their satisfaction, that's when we invite them to come in for a comprehensive evaluation and come up with a treatment plan for them. A lot of the conditions that they're being referred for can be managed quite effectively with things short of surgery. My treatment philosophy is to use as many tools as I can to help people return to function and live the life they want to live. So I tend to combine different types of treatment. So I'll oftentimes combine things like physical therapy with medication management, as well as these interventional strategies to try and maximize their chance of improvement in as short a time as possible. One of the tools that we have available to us as interventional physiatrists are injections using X-ray guidance. And that can be things like epidural injections if they're having complaints like that, or things like injections into the joints in the back or the joints in the pelvis, including the sacroiliac joint, as well as peripheral injections, depending on what their actual complaint is and what their physical examination and imaging studies look like. There have been recent concerns as far as the safety of some of these injections related to some of the medication that was compounded at a particular pharmacy out of state. Here at Michigan Head and Spine Institute, we do not use any products from that particular pharmacy. And we do inform our patients of all the potential risks involved with these procedures prior to performing them. And we like to have them be an active part of their treatment plan and make the decision with us as far as what the best treatment options are for them.